Greetings. Now, there's this fertility drug up here. The image is up here. It is called Clomid. 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 Scientifically, it is called clomiphene citrate. It's a fertility drug. However, I've realized that many women, and in fact, some healthcare workers abuse it. I notice that any woman that is trying to conceive now, huh, what they do is that as soon as they see a doctor or whoever they see, or they themselves, they will just go and buy Clomid and start taking it. Some even go and take it because they think that because they feel they want to have twins. Yes, I've seen women going to pharmacy to buy Clomid because they feel they want to have twins. They don't even know the side effect of this drug. Yes, Clomid helps women trying to conceive. But before you can take Clomid, there must be a condition. Clomid is good for women that are, yes, they are seeing their period, but they are not ovulating. It's two different things. There are some women, good, they will see their period, they will ovulate and see their period. There are some other women that they will not see their period, that they will see their period, but they will not ovulate. That's the group of people that Clomid is given to. Hmm? Anovulatory cycle. Women with anovulatory cycle. Anovulatory cycle are the women that require Clomid. And these women, because you need to ovulate, egg need to be released. Ovulation is the process of releasing egg. Eh? Egg need to be released for you to get pregnant, quite all right. Now, in anovulation, you menstruate, but egg is not released. Egg is not released. Anovulation is very common in women with polycystic ovarian syndrome. So those are the categories of people that need Clomid. And there's another one called letrozole. Those are the categories of people. But I noticed that the drug is now abused. The medicine is now abused everywhere. You see a lady will just message you and say she's on Clomid. Who gave you Clomid? You even see 20-year-olds, 30-year-olds are on Clomid. They are ovulating, no, they are still on Clomid. Now they will now over ovulate. Let me use the word hyper ovulate. That's why I want to tell you the side effect, because I noticed that you are taking this drug because you don't know the side effect of it. You are just taking it, you are enjoying it because some of you want to have triplets, quadruplets, quintuplets, have multiple gestation, plenty children at once. So you just enter market. Yes, you enter market, buy Clomid, and just start swallowing it. It's wrong. Now, the purpose of this video is to tell you the side effects of Clomid, so that maybe if you know the side effects, you will stop abusing Clomid, because the abuse has become too much. Clomid is not like vitamin C in the market. It's supposed to be a controlled medicine, but I don't know what's happening. Eh? One of the side effects, yes, this one, it does not really matter. It causes nausea and vomiting. It causes hot flushes. Sometimes you just feel like something like internal heat. You feel internal heat. It's common. Those are common side effects. Then you can have what's called okay, I mentioned hot flushing. I mentioned vomiting. I've mentioned the you can lose your hair. Alopecia. You can lose your hair. But the good thing is that it's reversible. And some women that are on Clomid, you notice that your hair is you are beginning, your hair is going back. Your hairline is receding. You can lose your hair. That's one of the side effects. But good thing is reversible. Then sometimes you can have blurred vision. You notice that when you take Clomid, you are not seeing well. Your vision is deteriorating, is getting bad. But the good thing is it's also reversible. Now, let me tell you some of the very dangerous side effects of Clomid. One is multiple gestation. You think it's easy to have twins or to have triplets or have 4 children at the same time. You are following social media where you just see a woman, you hear all those fake news they carry around. Say a woman gave birth to 12 children, no CS. You will be believing, say, oh God. See, all those things are scam. Oh. To have multiple gestation, do you know what it means? You even hear they say a woman gave birth to 8 children at home. All those lies, you just believe them and start. No, I know you want to conceive. See, I want you to conceive, but I don't want you to fall into that trap because I will tell you more of the side effects so that you'll be wise. Eh? You have to be careful, really. So that multiple gestation, you know how it happens. Clomid causes normally one egg is released. Clomid can cause the release of like 20 eggs at the same time. How many eggs do you have? Yes, I know they say you have millions, but as you age, they reduce in number. How many eggs do you have for your ovary to be releasing 20 at the same time? If your ovary is releasing 20 eggs at the same time every month, it will get burnout. Oh. It will get to a time nothing is there. I'm just telling you practical terms. Practical terms. So you release 20 eggs per ovulation. When you release 20 eggs per ovulation, what will now happen? Next month you release 20 eggs. That means in a year, 12 times 20. Calculate the numbers. How many do you have? So that's why you have to be very careful. All these women looking for twins. See, you will not have twins. If you want to have twins, your mother have to be twins, or you yourself, you are a twin as a woman. Or the most important thing, part of becoming giving birth to a twin is when there is a twin in your mother's side, or yes, on the woman's side, not on the man's side. So there's no drugs. You don't stop pursuing drugs, trying to use drugs to give birth to twins. Let the thing come naturally. Stop abusing Clomid. Now, there's another side effect. They call it OHSS, ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome. I've mentioned it before because you know how Clomid works. I didn't mention it before. Clomid helps to stimulate the ovaries. It helps to stimulate the ovaries so that it will release egg. That is how Clomid works. It helps to stimulate the ovaries so that eggs will be released. Now, it can get to a point where it stimulates it too much so that so many eggs are released at the same time. And you know, in ovarian, and that is called ovarian hyperstimulation. In ovarian hyperstimulation syndrome, it's a very dangerous syndrome that can even land you in the hospital. You'll be admitted. You'll be nauseous. Your body temperature will be high. You'll be vomiting. You'll get dehydrated. You have abdominal pain, severe abdominal pain. You can even have ovarian rupture. You may end up in theater. So be careful. I'm warning you now. It's not every drug you see you just jump into. And if you are some health workers that is watching this video that will just jump to Clomid and start prescribing Clomid and be giving it to people, to women trying to conceive, no, you have to stop. Ovarian hyperstimulation syndrome, you know what I mean. Go ovarian hyperstimulation syndrome and see what is there. Can damage the ovaries. That's two. Now, in ovarian hyperstimulation, it can lead to ovarian burnout. The ovary will get tired in such a way. Yes, you get to a point, the ovary get tired, get burned, and can no longer release egg. The fifth one that you need to know is called cancer, ovarian cancer. If you keep on taking Clomid, especially for women that take Clomid, some take Clomid throughout the year. Do you know over time, because the ovary is overworking, cancer can result from that. Ovarian cancer can result. Yeah, Clomid can cause ovarian cancer if you take it for too long and for too much. Because the ovaries is always being stimulated to produce egg, to release egg. Malignant change can happen from there. That is, cancerous change can happen from there, and you develop ovarian. That's why in women with ovarian cancer, they ask them whether they take some drugs like pregnant fertility drugs like Clomid in the history taking, and they ask them. So be careful. Now, thank you very much. Thank you. I've mentioned the side effects of Clomid, nausea, vomiting, ovarian burnout, ovarian hyperstimulation syndrome, blood vision, cancer, eh? Multiple gestation. But there's something you have not done for me. You have been trying for me, but there's something you have not done. You have not subscribed to my YouTube channel. You have not subscribed to my YouTube channel as you are watching this video now. If you know you have not subscribed, please help me. Help me, I'm begging you. Do this one for me, Christmas gifts or New Year gifts. Subscribe so that I can get to 1,000 followers. I am begging you, please. Thank you. Bye-bye.